the patient after stroke typically have sensory impairments or like motor impairments, like muscle weakness, or suddenly not able to pick up an object. They suddenly will not be able to do things that they were able to do on a daily basis, pretty simple, without thinking about it twice. Mentally, they can have, again, confusion or inability to calculate something or inability to recall something that they typically won't have an issue with on a regular basis.
So there's areas of the brain that are specific for speech, for understanding speech, and then also being able to produce speech. And unfortunately, the way the anatomy is kind of aligned, a lot of the time strokes happen to people on the left side where our language centers are. So oftentimes they end up with specific deficits in their speech, their ability to understand speech, and or their ability to then produce speech and communicate their needs, wants, that kind of thing.
The first thing we do is an evaluation to find out what the deficits are, and then we plan like a treatment around the deficits to address them. Also, we help them work on their muscle strength, improve their coordination, and then work on functional tasks that they can use them on a daily basis.
Speech therapy is instrumental in checking that their swallowing is still functional and safe. And that's really the first kind of initiative, is to make sure that their swallowing is safe. And we have some parameters to make sure that those swallowing assessments are done in a timely manner. Speech pathologists work with them to try to help improve their swallowing, get them back onto a diet if possible, and hopefully remove the peg tube from a swallowing perspective. And then from communication, trying to facilitate their recovery whenever means necessary, improving their language, providing them with a communication device if needed, just trying to support them and also their families. I always tell people strokes don't just happen to the patient, they happen to the whole family.
After stroke, the first few weeks are very important. Patients will improve in terms of learning a movement, learning coordination, learning their balance, and regaining their independence tremendously.
So in an outpatient setting, we work with them for quite a bit longer, usually, weeks to months for their recovery. And so it gives you an opportunity to bond with the family, really kind of become vested in what they need and what their goals are for improvement, and then being able to help facilitate that.